Hello everyone, welcome to my YouTube channel. Today we are going to discuss about the medication Inclisiran, which has been recently approved for the management of hyperlipidemia. And this is one of the first medication belonging to the category of siRNA based therapy. So in this video we will discuss what is Inclisiran, what is PCSK9, how does Inclisiran work, how this medication is administered, what is the dose, how we need to dose, adjust its dose, what are the side effects, drug-drug interactions, and storage. So let's begin. So this medication is called as Inclisiran. It is the generic name and the brand is Likivio. So this medication is based on gene therapy. So in fact, this is double-stranded small interfering RNA and it is called as siRNA. So when this siRNA is administered in the body, so it triggers RNA interference. And by triggering this RNA interference, what it will lead to? It will silence some specific genes in the body. In this condition, we are talking about PCSK9. This gene is silenced. So why this medication has been approved? This medication has been approved to lower the cholesterol levels, to lower the LDL levels. And as I told, this is one of the first medication from this category. And this medication has been approved for those patients who have been on the maximally tolerated dose of statins, but still their cholesterol levels are not managed. So what is PCSK9? PCSK9 is an enzyme circulating in the blood and it is formed inside the liver from this PCSK9 mRNA. So when this enzyme is formed, it circulates in the blood and its major target is LDL receptors located on the liver and it causes degradation of LDL receptors. When these LDL receptors are degraded, their population reduces. So what will happen? So the uptake of LDL from the blood will not happen or it will happen to a lower degree. So you can say there's a decreased clearance of LDL molecules. So what is the result? The result is LDL molecules remain circulating in the blood. So their levels increase, LDL levels increase, cholesterol levels increase. So this is the impact of PCSK9. So now what inclisiran will do? Inclisiran will inhibit, it will degrade PCSK9 mRNA. As a result, what will happen? So when this mRNA is not working, it is degraded, you can expect the decreased production of PCSK9 enzyme also. When this enzyme is not working, so LDL receptors remain intact. Their degradation is to a lower degree. When this degradation is less, so you can expect the LDL receptor population will increase. They are upregulated. So when these LDL receptors are functional, they are upregulated, they will increase the uptake of LDL molecules from the blood. And it is manifested in the form of decreased cholesterol levels in the blood, decreased LDL levels in the blood. This is the impact of this medication inclisiran. So structurally, you will find that a moiety called as N-acetyl galactosamine is attached to inclisiran. Question is why? Why this is attached? The answer is so that this siRNA molecule gets specifically delivered into the liver cells. How this kind of a mechanism works? In fact, as I told, this N-acetyl galactosamine is a sugar moiety which is attached to inclisiran. Why? Because we know on the hepatocytes, on the liver cells, these receptors are present. These acylo-glycoprotein receptors are present. And these two have a specific affinity. Means N-acetyl glucosamine, when inclisiran comes in the blood, this acetylgalactosamine specifically binds to acylo-glycoproteins present on the liver cells. So as a result, this inclisiran is specifically uptaken by the hepatocytes. This siRNA is specifically uptaken by the hepatocytes. This is why this moiety is attached to inclisiran. Now coming to its administration. So commercially, what kind of dosage form is available? This is available as a single dose pre-filled syringe, which is a clear solution. So this pre-filled syringe has a single dose of 284 milligram and the volume is 1.5 ml. This injection is administered by a subcutaneous route. The site of injection is abdomen, and who will administer it? By a healthcare professional, doctor, nurse, or pharmacist, not by the patient itself. Although it is subcutaneous, but it is not administered by the patient. The doses. So the recommendations are that we need to administer the first dose, and when we administer the first dose, we say this is a day zero. 284 milligram by subcutaneous route. So day zero is the first dose. And then when we have to give the second dose, the second dose is given after 3 months. Same dose you repeat after 3 months. Then what? Then subsequent doses, mean third dose, fourth dose, fifth dose, these kind of doses, they are repeated after every 6 months. So what you can say? You can say that there are two injections every year, twice yearly. This is how the doses are recommended for this medication. Dose adjustment and special population. So generally in renal diseases or hepatic diseases, we need to adjust the doses. What about this inclisiran? Do we need to adjust the dose? Answer is no. If we have a mild to moderate form of the renal disease or the hepatic disease, we don't need to any adjust the dose. But if it is a severe form, so there are no studies done for that one. Whether this medication can be given in children during pregnancy or geriatrics. Answer is for children and in pregnancy. This medication is not recommended. Children mean less than 80 years of age. But yes, it is approved for geriatrics above the age of 65. And for geriatrics, there is no dose reduction, no dose adjustment. Same dose we need to give. Side effects on monitoring. So side effects are very mild, and you can say this medication is very well tolerated. Most of the signs are related to injection site reactions, like a little bit of redness, little bit of pain, some pruritus like itchiness, some rash can be seen. In some of the persons, it has been seen that it disturbs glucose metabolism. Means the persons who are at the risk of diabetes mellitus must be monitored more carefully. And some of the very uncommon side effects may be a lower tract respiratory infection, nasopharyngitis, arthralgia, mean joint pain, back pain, UTI, urinary tract infection, diarrhea, headache, something like that. But overall, this medication is very well tolerated. Now, some other points, how this drug is metabolized by the enzymes called as nucleases to degrade to smaller nucleotides. Now, very interesting point is that it is metabolized and cleared from the plasma very early, but it remains in the hepatocyte for a long period of time. That is why you can say that it is a long duration of action, and that is why it is to be injected only 2 times in a year, because it was long duration of action. Regarding drug-drug interactions, till date, no significant drug interactions are known with this medication. And storage, we can store at the room temperature between 15 to 25 degrees C. We don't have to freeze this medication. So this is all about this medication. Thank you for watching my video. You can subscribe my channel for more clinical updates, and you can find us online by searching the website, Instagram, Facebook, or LinkedIn. Thank you once again.